Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. We're currently in the season of Mashramani and we're celebrating under the theme Mixing and Mashing as One Guyana. Today we'll be talking about healthy lifestyle practices even during this season, as I'm joined by Ms. Jillian Trim, the Acting Director of the Food Policy Unit. Welcome to the program, Ms. Trim.
Thank you very much, Alicia. It's a pleasure to be here with you.
So today we'll be talking about healthy lifestyle practices, and I want us to start by you telling us a bit about the roles and functions of your department and how you guys operate on a daily basis.
Okay, well, our department is the Food Policy Division, and I like to call it the Food and Nutrition Department of the Ministry of Health. So our mission really is to advise the minister on the food and nutrition situation in the country. We're also supposed to develop policies and programs to help to improve the food and nutrition situation in the country, and that is at a national level.
Yes.
So we have a lot that's riding on our shoulders.
Definitely. Could you tell us about the current situation here in Guyana with regards to food and nutrition?
All right, well, if I'm to speak to that, we can speak about the various diseases, we can speak about access and availability, we can speak about so many things. But based on our analysis and our data collection, we find that persons are not eating at the standard that we desire. So we have a lot of programs where we educate, because mostly that's what we do with food policy. We have education and training where we try to advise persons and to encourage them to eat healthy. And we speak of the benefits of having a healthy body, being a healthy weight, and having a healthy, balanced diet as your daily practice.
Yes, definitely. I know that you guys do a lot of work in the fields.
Yes.
With regards to education and so on. How do persons respond to the information that you guys are readily able to provide?
Yes. What we find is that persons, they have a desire to eat healthy and to be healthy. That is their desire. But where we find the fall down is where they actually want to stick with the program, to implement and to stick with the program. We find a lot of persons, they start and then they get tired and they don't want to continue. Because remember, we're accustomed to all of the sweet foods and all of our bad habits. We're accustomed to, and sometimes it's not easy to break those habits. But we have to encourage persons that in order to see results, they have to be consistent. They have to be determined to ensure that they get to a healthy weight and that they practice a healthy lifestyle every day, which includes not only a diet but also exercise.
Yes, definitely.
I would also like to say that in the food policy, we run 4 programs. We have breastfeeding education and awareness. We do anemia education and awareness. We do a little bit of surveillance. And we also do nutrition education.
Wonderful. Much variety there, I must say. We're currently in the Mashramani season here in Guyana, where food and drinks are major components. Ms. Trim, can you provide some tips for choosing healthy foods during this season?
Yes, I know, because this is the holiday where we eat, drink, and be merry. So we have to be very careful. And I saw a quote once that says, too much of anything is a poison. Right? So we always speak about moderation, especially in terms of our alcohol consumption. And in terms of your picnic baskets, we know that a lot of persons will be going to the park, will be going on the streets, will be purchasing food.
Yes.
Try to make healthy choices. And when you pack your basket, always make sure that you have items from all 6 food groups. You have your legumes, you have your food from animals, you have your fats and oils, which will be incorporated in the meal. Fruits and vegetables are very, very important. I know a lot of parents opt for giving the children the packaged foods. I know it's very easy and it's very accessible, but those packaged stuffs are what we call processed, and they contain a lot of salt.
Yes.
So we advise persons, instead of going for those, go for a fruit instead, or pack a fruit. You can dice it, you can slice it, you can do so many things with it, and give your children a healthy choice. And if you start early with encouraging them to eat a lot of fruits and vegetables, that will become part of their lifestyle and part of their diet on a daily basis. Because with these packaged stuff, we have to be very careful because, like I said, they're processed. And most times, the more processing that a food goes through, it becomes void of nutrients. The nutrients is destroyed, the flavor is destroyed. As long as nutrients go, flavor goes.
Yeah.
So we tell to at the end of the processing, we just have a food that is void of nutrients and it's just a filler. It fills you up but it doesn't provide any nutrients. And then sometimes what happens to add back flavor, what the manufacturers do, they put salt or they put sugar or they add fat. Right, so we always advise persons try to avoid the packaged foods, try to avoid the fizzy drinks, the aerated drinks, because we know they're loaded with sugar. And sugar is what we call empty calories. It doesn't provide anything else but just calories. And if calories are not burnt, they're stored. And that's how we find the weight starts to creep up on us. So avoid the sugary drinks, avoid the packaged stuff. Lots of fruits and vegetables.
You
Can't go
mentioned
wrong.
something that I find very important. You said slice it up when it comes to fruits and even
Yes.
vegetables. And when you said that, I thought of making the food more attractive.
Indeed.
And I know a lot of kids are going to be out there on the road and so on. So you want to encourage them to have or to take healthy snacks.
Yes.
Right? So how can parents make food more attractive for children, especially those who will be out on MASH day?
Right. Well, you know, children are attracted to brightly colored
Yes.
things. And fruits have a lot of color. So in the same, you can put it in a little Ziploc bag. You dice the apples, or you put the mangoes, you slice it, you have pawpaw, you have watermelon. You can put it in a bowl and make a fruit salad. And you can give it to the children, and they can munch along as they sit watching the floats go by or watching the parade.
Very great idea.
Yes.
For diabetics and other patients with health conditions, do you have any tips for those persons? Because I know that they too will want to enjoy and join in the festivity at this time.
Yes, but they have to be very careful, because remember, for diabetics, we usually recommend that they don't eat like large meals. They have to divide their meals in very small portions so they can have the slow release of the sugar. We don't have the spiking of the blood sugar, because once the blood sugar spikes, it sends a message to the pancreas, and the pancreas now has to make the insulin. So, which now the sugar now has to get into the cells. So we advise persons to eat small portions, small healthy portions. So you have the slow release of the sugar, then the body can use that over time. So we don't have the spiking. So for diabetics, you need to be very careful and ensure that they follow the doctor's orders as it relates to their diet.
Definitely. We're going to go into a break and be right back with more on healthy lifestyle practices.
Mom, why am I fat?
One in 3 children in the Caribbean is overweight or obese. 41 million children under 5 years, 340 million children between the ages of 5 and 19 were overweight or obese in 2016. They are more likely to become obese adults, have an increased risk of early onset diabetes, heart disease, breast and colon cancers. Obesity is preventable. Make healthier food choices and engage in regular physical activity to reduce childhood obesity. A message from the Ministry of Health, Chronic Disease Unit.
What do you call it? Cold one, hard stuff, booze, liquid courage? The list is long, as is the list of its effects on the brain and body. We know the behavioral changes, we've seen it before. Slurred speech, changes in mood, unsteady walk, or even total loss of consciousness. It can cause other bodily damage too, like damage to your heart muscle, high blood pressure, stroke, liver damage, immune system suppression. It's also a known risk factor for cancer. Those are just to name a few. What about the people around you? Alcohol can influence domestic violence and cause road fatalities. Don't cause or become a statistic. Stop, think, don't drink. A message from the Ministry of Health, Chronic Disease Unit.
Ms. Trim, can we talk a little bit about the food-based dietary guidelines for Guyana? We can touch a bit on that now.
Yes. Now, these guidelines were developed by the Ministry of Health and also FAO. And they were designed based on our context and our culture here. And if you notice, for the food-based dietary guidelines, we use the stew pot as the logo, or the cannery. And that's because everybody's familiar with the cannery. And we use that to show the 6 food groups. Now, before, in 2005, we had launched the guidelines, but there were only 7 guidelines. And they made some adjustments and added, especially breastfeeding. So now we have 9 guidelines, and these are designed to help persons to prevent nutritional deficiencies, to help to maintain a healthy weight so that we don't have persons who are overeating and becoming obese. So it helps you to maintain a healthy lifestyle. And it also, one of the guidelines also includes exercise, right? Because diet and exercise will help you to maintain a healthy lifestyle. And if I'm to go through the guidelines with you, the first guideline says that you must breastfeed exclusively for the first 6 months. And that's one of the things that we promote at the food policy. We promote exclusive breastfeeding, which is breast milk alone, from birth to 6 months. I know some persons may feel, oh, that is not enough for the baby, but that is a balanced diet and has everything that the baby needs.
And just to add, I know some parents, some mothers will be out there with their babies on match day,
Yes.
and we want them to know that breastfeeding is still important, even on
Yes,
match day.
even on match day. And wherever you are, you can just ensure that you're covered and
Yes.
you breastfeed your baby, because we know how these babies are sometimes, and they love when they to get their breast milk. So, and I always say too, the best gift of love that a mother can give to her child is to breastfeed. And that's why breastfeeding is guideline number 1, because breast milk is the first food. So that's the first guideline. And if we to look at the second guideline, it says eat different types of food from all the food groups daily. And there's a picture of the cannery that is on the picture. Oh, it's on the food-based dietary guidelines, and it shows the 6 food groups where you have your staples, you have your legumes, your food from animals, your fats and oils, your fruits, and your vegetables. So we have to ensure that we eat from all of those food groups daily, because each group provides its own set of nutrients. And if we eliminate maybe a group or two, we could find ourselves running into deficiency. That's if it goes on for a lengthy period of time. The next guideline says eat more green and other colored vegetables daily. And we know the colored vegetables are rich in vitamin A, they're rich in antioxidants, and rich in all of the vitamins and the minerals. So we encourage persons to eat every day the colored fruits and vegetables. Then guideline number 4 says eat different kinds of fruits daily. And one of the things I love about Guyana, when you go into our market, you see a wide variety of fruits. So even though it may be a bit expensive, but we have the fruits that are available to
Yes.
us. And guideline number 5 said limit the use of sugary foods and sweetened drinks. And I touched on that earlier. Asking persons, instead of choosing the fizzy drinks or the aerated drinks or the drinks that have a lot of sugar, and we need to encourage persons to start reading labels, look for the sugar content, because sometimes just one beverage will have almost the total amount of sugar that we're allowed for the entire day. So if you use that one beverage, you don't have maybe just 2 or 3 more tablespoons that you can consume, right? And if you choose to have 2 of those, you're gone beyond the required amount of sugar for the day. So try to avoid the sugary drinks and the sweetened beverages, and also the salty snacks. And guideline number 6 says use more natural seasoning and less salty products. And we have lots of natural seasonings here. We encourage persons to season your pot with the natural herbs and spices. We have our shallot, our onion, garlic, thyme, ginger, all of those things that are available at the market. So use that to flavor your pot instead of the aji, or the monosodium glutamate as we call it, and the cubes and lots of salt. Use that and we get all of the benefits from the herbs and the spices.
This is a good tip for food preparation for those persons who
Indeed.
plan not to purchase food on the road, but probably
Yes.
prepare their own, their own pots and so forth.
Because when you prepare your meals, you know exactly what's going into your meal, because you know what you are putting
Yes.
into the meal. But when you buy food, let's say from a street vendor or anywhere else, you're not sure. Right? It may taste good because they have added all of the flavor enhancing herbs and spices, or aji and cube and so on. So we have to be very careful in terms when we choose to purchase on the road. The next guideline says use natural seasonings. No, we did that already. Next guideline number 7 says reduce your intake of oily and fatty foods. While our body needs fat, because fat is essential, because we have fat-soluble vitamins that require fat for digestion. Fat is required to insulate our organs and so on. The problem comes when we use too much fat. So we have to ensure that we use fat in moderation. And there are certain guidelines that we can use. We have the hand jive that can give you a measurement as to how much fat you need to put in your cooking when you're preparing your meals. So try to avoid the fatty foods and the oily foods. And guideline number 8 says, if you drink alcohol, do so in moderation. And this guideline usually always causes a discussion, sometimes heated and sometimes lengthy discussions.
Indeed.
Because persons may say, what's moderation for you may not be moderation for me. And we always preach moderation when it comes to alcohol, because we know of the ill effects of alcohol, and we know of if a person is alcoholic and they consume too much alcohol, we know that the risk factors
Yes.
in terms of the chronic diseases that they're setting themselves up for. And we usually recommend in the food policy 1 drink a day, 1 shot a day. I know a lot of eyebrows are being raised out there, but we always say moderation when it comes to alcohol. Don't overdo it, because it has a negative effect on the body. And the last guideline says use at least 30 minutes of exercise daily. That's physical activity. So, and we touched earlier on the importance of physical activity in terms of diet and exercise. The two go hand in hand. And exercise has a lot of benefits, so many benefits.
Yes,
in terms of relieving stress, in terms of our bodies working better. It improves your heart rate, it strengthens your heart, increases your circulation. And once your circulation is increased, all of the functions of the blood are optimized. So the blood takes oxygen faster to all of our organs. It clears away waste faster, and it also takes nutrients to the organs. So we have to ensure that every day we exercise for at least 30 minutes. And I'm not sending persons to go and buy weights and buy your mat and buy all these fancy outfits. Just ensure that you have a comfortable shoes and you can do brisk walking around your neighborhood. You can use your stairs, go up and down on your stairs, but just ensure that it is brisk and you raise your heart rate and you sweat a little. Every day, just 30 minutes we recommend. If you can do more, do more.
Definitely. Thank you so much, Ms. Trim,
You're
for joining
welcome.
me in the program. And I want to encourage you to keep up the good work that you've been doing at your department.
Thank you very much.
Do enjoy the Mashramani festivities and stay safe. I'm Alicia Martin saying goodbye for now.